This is a recording for basic EKG and sinus rhythms. We'll look at a basic rhythm, the waveforms, and the intervals. This is not a substitution for your online lessons. You must look at those for more details. This is just a brief overview. When you identify a strip, there are 6 steps that you need to go through. So be sure that you write those down and you follow it every time. Your first step is going to be about regularity. And this is how regular the rhythm is, beat to beat. And we're going to look at R waves. So is it regular from this R wave to this one, to this one, to this one? For the most part, you can just look to see whether it's regular or irregular. If you can't tell, you can put a piece of paper down on the EKG strip, put a little tick mark for this R wave, a little tick mark for this, and then pick up your piece of paper and march it down to see if it is regular. You can see if it's regular R to R and also P to P, but typically we're looking at R to R and whether it is regular. The next thing we do is we need to count the heart rate. And we're going to count the heart rate by the quick and fast method, which is how many R waves we see in a 6-second strip. This is a hash mark. This is a little hash mark, and this is a hash mark. This is 3 seconds. This is 3 seconds. So combined, this is a 6-second strip, and we only count the R waves that are between these hash marks. So we have 1, 2, 3, 4, 5. We do not count this last one because it is outside the hash mark. So we have a heart rate in the 50s, somewhere between 50 and 59. So you can count and then multiply by 10, or you can just count by tens. The next thing we need to do is identify our waveforms, and we're going to look at P waves, PR intervals, QRSs, and T waves. So here's your P wave. It should be smooth, round, and upright. There's one before every QRS. Here's your QRS. This is your PR interval. It is counted from the beginning of your P wave to the beginning of the QRS. Now, some rhythms don't have this little Q, and that's okay. And then we're going to look at our T wave, which follows the QRS. They're usually bigger than a P wave, so that's how you identify them. And we'll also talk about this little ST segment, which should be at the isoelectric line. So let's look at our waveforms some more. So your P wave is atrial depolarization. That's when your atria constrict. They're smooth, upright, round, and we have one before every QRS. So we have a couple examples. Here's P waves here, and here's P waves here. Your QRS complex. If you have a Q wave that's considered an old MI, it needs to be 1/4 to the 1/3 the size of the R wave and at least 1 box wide to be a Q wave. So your QRSs can go up, they can go down, they can go up and down, as in this example. This one goes up, and it is all entirely normal. Your ST segment should be at the isoelectric line. If it's elevated, and that is this rhythm strip, these strips are found in your EKG book. My ST segment is all the way up here. My isoelectric line here is down here, and that is injury, and that's an emergency situation, and your patient is having a heart attack. If it is depressed below the isoelectric line, so I have a depressed ST segment, that is ischemia, which means your heart is not getting enough oxygen. Your T waves are, your QRSs are ventricular depolarization. When your ventricles are in ventricular depolarization, your atrias are in repolarization. They are resting. We don't see it because our ventricles are so much bigger and have so much more electrical output. Your T waves are ventricular repolarization, which is resting, and they follow the QRS, and they should be up. Right? If they're flipped, as in this bottom example, this is a flipped T wave, that means ischemia as well. So we have ST segment depression, we have flipped T waves. U waves are very rare. If you see them, They are after the T wave. They don't look like a T and they don't look like a P, and they are a sign of hypokalemia. So this is a normal EKG rhythm where I have P, QRS, T. Everything's at the isoelectric line. This has ST elevation. This has ST depression. And you should notice that this second waveform is also tachycardic. So let's talk about intervals. So this is EKG paper. So we have a bunch of boxes. This is one dark line to dark line is brought here, and then one of these little boxes is brought here. So you can see in this example, which is the very first strip of the slide, and I just clipped out two of the QRSs and blew them up really big where you can see them. This is a dark line, so we have a box here. So this is what we're looking at here. Horizontally across the strip is time. So each small box is 0.04 seconds. One large box is made up of 5 small boxes. 1, 2, 3, 4, 5. 5 times 4 is 20. So this is 0.20 seconds. And then when we talk about the elevation, these are millimeters. In any elevation of ST segment elevation of 1 millimeter, which is one small box, in more than one lead that looks at the same area of the heart is considered ST elevation and injury and your patient's having a heart attack. So it's important to know your multiplication tables because we're going to count when we count a PR and a QRS how many small boxes. So a normal PR is 0.12 to 0.20, which is 3 to 5 small boxes. A normal QRS is 0.04 to 0.10. So one small box to 2.5. You can cut and count a box by half, but you can't make it any smaller because it's so tiny. So let's look at this first complex. What you want to do is find a P wave that starts on a line. So when you start to count your P, and this is the hard part that everybody has trouble with, is here's my isoelectric line. Just as soon as this comes up, this P wave comes off the isoelectric line, I want to start counting that. So I'm going to count on this dark line, and I'm going to count down to the QRS starts, which is right here. So you can see my mouse move. You can mark that in your EKG book. So you take a mechanical pencil because it has a little tiny lead, and you can mark those. So we have 1, 2, 3, 4 small boxes. 4 times 4 is 16. So my PR interval is 0.16. Now we're going to count our QRS. So the QRS, we start at the same point we stopped counting for our PR interval, and we're going to count to here. So I can see that I have one full box and I have a partial second box. So I'm going to count this as half. So I have 0.04 and half. So my QRS is 0.06. So let's look at sinus rhythm. Sinus rhythm is what everything is based on. This is what gives us our normal hemodynamic effect. And so sinus rhythm is regular. It has a rate of 60 to 100. So let me talk about what that means. That means when you count your R waves, you count between 6 and 9. Because at 9 R waves, your heart rate is somewhere between 90 and 99. If you count 10 R waves, then your patient is tachycardic because their heart rate is between 100 and 109. You have normal P waves. You have a normal PR interval. You have a normal QRS complex, and the hemodynamic effect is optimal, and of course there's no treatment. So let's look at this strip. I have a heart rate, I'm not going to count this one, of 10, 20, 30, 40, 50, 60, 70. I have one P wave for every QRS. My P waves all look normal, they all look the same. I have one T wave. My ST segment is at the isoelectric line, so I don't have any worries. So let's count a PR interval for this one. 1, 2, 3, 4, and then 1 here. So my QRS is 0.08. My pure interval is 0.16. So what is that? Sinus tachycardia. Sinus tachycardia is sinus rhythm with a heart rate greater than 100. It's between 100 and 160. Everything else is normal, and the hemodynamic effect varies depending on the heart rate and how much change in cardiac output we see. So the faster they are, we could have a decrease in cardiac output, and then they would have signs and symptoms of decreased cardiac output. So in your soft talk files, your online lessons, you have the listing of signs and symptoms of decreased cardiac output, and that comes from your textbook in chapter 7. So the treatment for sinus tach, if they are symptomatic, then we would give digoxin to slow their heart. Now, just because somebody's in sinus tach does not mean that we have to treat it. It is a common occurrence if somebody gets up and walks, or somebody runs on a treadmill, or if you're ill and you have fever or in pain. So just because they have sinus tach doesn't mean you have to treat them. You have to identify what is going on with them and are they symptomatic. Sinus bradycardia. Sinus bradycardia is a heart rate less than 60. It's a heart rate between 40 and 60, and it's sinus rhythm. It's just slow. We have a normal P wave. Our PR interval is normal. Our QRS is normal, and they may have signs of decreased cardiac output because they are slow. And the treatment for symptomatic bradycardia is atropine. So the key to treating rhythms is the patient symptomatic? And if they are, then we need to treat them. If they are not, then we've got some time to decide why this is happening. Now, just because you are in sinus brady doesn't mean that there's a problem. When you go to sleep, your heart rate will slow. If you are an athlete or exercise a lot, you will have a lower heart rate. That doesn't mean I have to run in there and give you atropine. I will only give you atropine if you require it. So I hope that helps you understand basic EKG and your sinus rhythms.